I got it. So at our institution, we developed a protocol for appropriate use of Oritavancin, and one of those implications in that protocol is using Oritavancin to expedite patients who are admitted inpatient to expedite their discharge. So in this study, we looked at patients who received Oritavancin to expedite their discharge, and we looked at patients who received conventional treatment with vancomycin and oral antibiotics. In terms of cost avoidance, even though we spend a significant amount of money for the medication, which is about $2,700, we save money in the long run because we are reimbursed based on DRG or diagnosis-related group. And for us to receive that, it doesn't matter how many days the patient stays in our hospital, we get the same flat rate. When the cost of a hospital admission is $2,750 a day for a patient to walk through our door and sit in the hospital, not including any labs or tests or drugs or nursing time, and we only get reimbursed about $5,400 of that, we want to try to match that as close as we can. In terms of clinical implications, by using Oritavancin, our patients have less time in the hospital because we're using it to get them out. A lot of times we keep patients inpatient to just give them IV antibiotics because we maybe don't think that they'll take oral antibiotics, or they're have too severe of an infection to take oral antibiotics. So we keep patients in the hospital longer just to give IV antibiotics. But Oritavancin completely eliminates the need for patient compliance. We give them the once infusion, and the patient receives antibiotic treatment for the whole course as they would staying in the hospital with IV. Additionally, patients have less recurrence of infection, as we saw in the study,